Yeah.
Barbara, if I may, I'm going to bring in Dean, who's got a follow-up question for Daphne.
Yes, thank you, Daphne.
Thank you.
Thank you, Daphne, and sorry to hear about the experiences you've had. The question I had was related to the word you used about coordinated, and I just was interested to understand how you felt the system was joined up, or in this instance wasn't joined up, and where you think things could have been improved across the different settings. So you mentioned 3 hospitals. The different hospitals were involved. How could that have been improved in your view?
Well, it was one hospital for the 3 admissions. And
sorry, yeah.
No, that's okay, just to clarify. And they do have a hospital discharge team. What they call it is an integrated hospital discharge team. And it's made up of health and social care professionals. But there seemed to be no sort of overall coordination to make sure that the health and social care elements of that discharge team actually provided an integrated assessment and package of care for hospital discharge. So they seem to work in silos. And my perception was that I felt that the social care professionals did not have the seniority and influence to be able to get the input they needed from NHS staff, both in hospital and in the community, to make sure that the healthcare part of it was actually planned for and delivered. So I think social care was left on their own to sort of struggle with a very difficult situation where complex health needs needed to be dealt with, but they were just sort of being left to the side.
Thank you. We need to move on to listen to some other witnesses, but I just wanted to say thank you, Daphne, for talking to us. I'm sure your mother, Dorothy, was a very special person. I was health secretary when she was admitted to hospital for the first time, and I think the least I can do is apologise to you for the fact that we didn't manage to sort out the disjuncture between the health and social care systems in time for Dorothy's care. But I hope we can do something as a select committee to highlight both the problem and the solutions. And thank you for taking the trouble to talk to us in such detail about what you've